Welcome back. Although traveling during a pregnancy is normal and a lot of women do it, it is important for pregnant women to practice safe driving. So OB/GYN Dr. Tara Morse from Touro here to give us some car safety tips. We appreciate you stopping by. Good morning.
Good morning. Thank you.
So statistics show about 32,000 women in 1 year pregnant women will be injured in a car accident. What's your reaction to that?
I mean, it's a very high statistic, and we actually don't even know if that is a correct number because a lot of pregnant women don't know that they should come and actually report that incident to their doctor. So the numbers could be even higher, especially during the summer travel season.
So even higher. Wow, that's interesting. Touch on seatbelts. You know, I would imagine there's a little bit of misconceptions, maybe even a little bit of fear to wear the seatbelt. Is there a specific way pregnant women who are watching right now should be buckling up?
Yes, exactly. So we always recommend a 3-point restraint, meaning you have a full 3-point seatbelt. The top part of the belt should be kind of at the shoulder joint, but not off the shoulder, which I think is a lot of pregnant women, they want it to be more comfortable, so they actually put it on the shoulder off the side, and it shouldn't be like that. It should actually come down through the breastbone, between the breast tissue, into the side of their belly, not over the belly. Any impact in that seatbelt will cause pressure to the growing baby. The bottom belt should go between the hips, the bony hips, and well below the pregnant belly, so that there's none of that impact pressure.
Good point.
And it's really important.
That's good to know, especially the way you should position the belt.
And I always tell my pregnant women, you know, once you kind of have your seatbelt position, then we have to talk about where the seat is in the car. So, you know, a lot of women feel more comfortable driving really close up to that steering wheel, but in pregnancy, that's a big no-no. You got to be away from the steering wheel, have that steering wheel at your breastbone, no more than 10 inches away, in case there is an airbag that deploys. And the other important thing is to make sure that you're not reclined back too far, so you need to be able to safely reach the pedals, of course.
Of course. And kind of touch on airbags. I would imagine that's a little bit of a scary issue. Yeah,
I have a lot of pregnant women ask if they should continue using their airbags, and of course they should. So we do recommend that you use both your front and side airbags. Do not turn them off. Do not prop something against it so the car automatically senses that you shouldn't have an airbag deployed. The American College of Obstetricians and Gynecologists, we absolutely recommend airbags. The risk to the pregnancy or to the pregnant mother and herself, you know, does not outweigh the benefit of airbags in pregnancy.
That's a good point. If you kind of look at it in the strategic way. Touch on, unfortunately, if you do get in an accident and you are pregnant, what is the quickest and most efficient way to handle this for you and your baby's health?
Of course. So the first thing that we always recommend, you know, is call your doctor immediately. If it's a severe accident where you're on the interstate, call EMS. Make sure someone calls, you know, emergency medical services. We do recommend that you'll probably, once in talking to your doctor, they're going to recommend that you go to the hospital and that you actually have a prolonged stay, anywhere from 4 hours to a day generally, but they want to monitor your baby's heart rate for any risk or any injury. And the scary thing about pregnancy and traveling in a car is even if you don't have any physical looking injuries, you can actually have a high risk for preterm birth later on.
Wow. Okay. Well, we appreciate all your great tips. I know a lot of moms will be heading out on the road this summer.
Yes, thank you so much. And if women ever need any additional information, they can go to touro.com/FBC for Family Birthing Center.
Okay.
Thanks.
Alrighty. Well, thank you for your time.
Thank you so much.
And again, for more information, that website right there on your screen.